All right, you guys. So today's lesson is on infectious diseases, and one of the infections that I want to talk about is Mrsa. I know we've all have heard of Mrsa, but actually, what is it? So Mrsa infection is caused by a type of staph bacteria that becomes resistant to many of the antibiotics used to treat ordinary staph infections. So that's all that it is. It's a staph infection that doesn't react to antibiotics that it normally would react to. So there's basically is a resistance, right? Okay. So there are two types of Mrsa. We have community acquired, and that is basically what acquired in the community, right? And then we have hospital acquired, meaning you got that while you're were hospitalized. So whether you're in a nursing home, the hospital, you got this while you were hospitalized, and it either could be through invasive procedures like you had surgery, or it could be through blood pressure cuffs if they're not being cleaned in between use, or it could be, you touching a surface in your room, or it could be spread by the healthcare providers as well. All right, so what are some risk factors? So first we're going to talk about the community. So what puts patients at risk to get Mrsa if they're in the community? If they have any type of skin trauma, so you have any cuts, sores, so we know that how does the Mrsa bacteria actually get in, right? Because it can live on our skin, but how does it get inside of our skin when we have a break in skin? So when we have a impaired skin integrity, that bacteria then can come on in the inside. Athletes, why do you think athletes? Because they deal with a lot of contact sports, right? With you shaving or waxing, you know that basically is impaired skin integrity. Tattoos and piercing, what are those? Opening in the skin, right? So also physical contact with a person who is draining, cuts, or sore, who is a carrier of Mrsa, and we'll talk about being a carrier later on, and also sharing personal items and equipment if not clean. All right, so hospital acquired. So this is having a surgical wound or having an IV. Why having an IV? Because guess what? It's going inside the skin, so there is an opening in the skin. Being hospitalized for a prolonged period of time. Recent use of antibiotics if patients have weakened immune system, and being in close proximity to patients who have Mrsa, or healthcare providers who have been taking care of patients who have Mrsa. All right, so what are your signs and symptoms? So sometimes Mrsa is easily pushed off and not seen as that important, but you will see it look like a little pimple, or spider bites, however you want to say, but it looks like a little pimple, as you can see on this picture, and then it's going to be warm to touch. It could be full of pus or other type of drainage, and it will be accompanied by a fever. So the biggest thing is that we want to get this treated. And why do we want to get this infection treated, right? While it's just there in our skin, right? It's just there in our tissues. We want to kind of stop it right there. Why? Because if it's left untreated, it can go into your bloodstream, and you can have a bloodstream infection, which is what? Sepsis. So we want to make sure that as soon as that patient notices those signs and symptoms, that they come in and they be treated, all right, because it can spread right throughout the body. All right, so another type of Mrsa. So we have, once you go to the hospital during this semester, you will see that a lot of patients are on contact for Mrsa. And do they actually have an active Mrsa situation going on? No, but a lot of patients are just carrier of Mrsas, right? And it normally just lives in their nose. I know a couple years ago we used to test everybody for Mrsa who came into the hospital, and so many people were coming back positive because they were just carriers of it, but they didn't actually have the active infection. So they actually stopped testing for Mrsa unless that patient presented with some signs and symptoms of it. So if a patient has Mrsa, they're going to be on contact precautions. Why? Because it's past through contact, right? So that patient is going to be on contact precautions. You will see in the hospitals, I'm even guilty of it, of really not gowning up. Like, we really don't take MRSA seriously as we should, but because we know that there's, I think 1/3 of the population actually has a colonization of MRSA. So this patient is just not going to have any symptoms displayed. They won't know they have it unless you actually test for it. All right, but an active infection, these patients actually have the active infection going on. So the MRSA has entered the body through a wound. There has to be a break in the skin, for a person to get MRSA, or if they touch something, and put it in their mouth and stuff like that. But it has to be a break in the skin. It has to be a way that it actually gets inside. So that patient is going to have some symptoms, right? And infections can be community acquired or hospital acquired. It doesn't matter. Like, you can, if it's active, you can be active in the community. You could have got it active in the hospital. So how is it diagnosed? So if you have a wound, we can take a wound culture of that, and it'll come back and let us know if the wound has MRSA. And then I talked about earlier how we did the nair swab, and like everybody was getting those. So this is a great picture of the nair swab. So if you don't know how to do a nasal swab, I suggest you look that up, because you can see that somewhere. All right, so how is it treated? It is treated with antibiotics. So you're like, Dr. B, I thought you said that it's antibiotic resistant. No, it's only a certain antibiotic resistant, a certain type of drug class resistant. So that's why we don't want our patients taking antibiotics for no reason. We don't want to have our patients continually taking antibiotics when they don't need them, because they can build up resistance to the antibiotics. And when they do need them for cases like this, because there are only a certain amount of medications that can treat MRSA, we don't want them to build up a tolerance and a resistance to that. So definitely a treatment will be antibiotics. All right, so prevention, what can we do? So if you have a wound or sore, don't pick at it. And I know that's like, Dr. B, we are grown, we are adults. But if you ever had a wound or you ever had a pimple or something, you will find yourself messing with it. So you want to make sure that you keep all your wounds covered, and you want to keep it dry with a clean bandage. So basically, big on wound care, keeping that area clean and dry. All right, we want to make sure you're washing your hand. Hand hygiene, hand hygiene, hand hygiene. Even after you touch your bandage, even between your patients, making sure that you're putting on your proper PPE, putting on your contact precautions when you're taking care of a patient who has MRSA, because you don't want to spread it, right? Also, and don't be sharing personal items. So especially when we come to kids who participate in sports, moms, you guys probably know that your kid loves to share everything, but you do not want to share your personal items. All right, so that is prevention on what we can do